Gastroenteritis, commonly known as the stomach flu, is a widespread condition that affects people of all ages and backgrounds. It affects millions of people globally each year, causing significant discomfort and disruption to daily life. This uncomfortable ailment involves inflammation of the gastrointestinal tract, which includes both the stomach and the intestines. The inflammation can lead to a variety of symptoms, including nausea, vomiting, diarrhea, and abdominal pain. While often mild and self-limiting, understanding its causes, symptoms, and treatment is crucial for managing the condition effectively. Gastroenteritis can disrupt daily life, leading to significant discomfort and dehydration, which can be particularly dangerous for young children, the elderly, and those with weakened immune systems. It's important to remember that gastroenteritis is distinct from influenza, which primarily affects the respiratory system and presents with symptoms like fever, cough, and body aches. Recognizing the differences between these conditions helps individuals seek appropriate medical care and avoid unnecessary treatments. Throughout this essay, we'll delve deeper into the various aspects of gastroenteritis, providing a comprehensive understanding of this common yet often misunderstood condition. We will explore its triggers, such as viral, bacterial, and parasitic infections, and how it spreads through contaminated food, water, and close contact with infected individuals. By understanding the ways in which gastroenteritis spreads, we can take proactive steps to protect ourselves and our communities, such as practicing good hygiene, ensuring safe food and water consumption, and staying informed about outbreaks. Effective management of gastroenteritis symptoms often involves rest, staying hydrated, and using over-the-counter medications to alleviate discomfort. In more severe cases, medical intervention may be necessary, including prescription medications and intravenous fluids to prevent dehydration. Public health initiatives play a crucial role in educating communities about gastroenteritis, promoting preventive measures, and providing resources for those affected. Simple actions such as regular hand washing, proper food handling, and staying home when sick can significantly reduce the spread of gastroenteritis. Ongoing research and collaboration among healthcare professionals are essential for developing better treatments and preventive strategies for gastroenteritis. With the right knowledge and practices, individuals and communities can effectively manage and prevent gastroenteritis, ensuring better health and well-being for all. As we continue to learn more about gastroenteritis, we can improve our responses to this common condition and enhance our overall public health efforts. By staying informed and proactive, we can protect ourselves and our loved ones from the discomfort and potential complications of gastroenteritis. Thank you for joining us in this exploration of gastroenteritis. Stay healthy and take care. Gastroenteritis typically arises from infections, with viruses being the most common culprits. These infections can spread rapidly, especially in environments where people are in close contact with one another. The viruses responsible for gastroenteritis are highly contagious and can be transmitted through contaminated food, water, or surfaces. Norovirus and rotavirus are particularly notorious for causing outbreaks, especially in closed settings like schools and cruise ships. These viruses can survive on surfaces for days, making it easy for them to spread from person to person. Hand hygiene is crucial in preventing the spread of these viruses, as they can be easily transferred through touch. Bacterial infections, such as those caused by E. coli and Salmonella, are another significant cause, often linked to contaminated food or water. These bacteria can thrive in improperly cooked or stored food, leading to widespread outbreaks. Food safety practices such as proper cooking and storage are essential in preventing bacterial gastroenteritis. Parasitic infections, though less frequent, can also lead to gastroenteritis. These infections are often contracted through contaminated water or food and can cause severe symptoms if not treated promptly. Parasitic infections can be particularly challenging to diagnose, as their symptoms can mimic those of other gastrointestinal conditions. Cryptosporidium and Giardia are parasites often found in contaminated water sources, particularly in developing countries. These parasites can cause prolonged and severe symptoms including diarrhea, abdominal pain, and dehydration. Access to clean water and proper sanitation are critical in preventing parasitic gastroenteritis. These microscopic organisms can cause prolonged and severe symptoms, highlighting the importance of safe drinking water. Water purification processes, such as boiling or using water filters, can help eliminate these parasites and reduce the risk of infection. Education on safe water practices is also essential in preventing gastroenteritis in vulnerable populations. While infections are the primary drivers of gastroenteritis, non-infectious factors can also play a role. These factors can include certain medications, which may irritate the gastrointestinal tract and lead to symptoms of gastroenteritis. Additionally, food intolerances, such as lactose or gluten intolerance, can cause similar symptoms when the body is unable to properly digest certain foods. These include certain medications, food intolerances, and underlying medical conditions like inflammatory bowel disease. Inflammatory bowel disease, which includes conditions such as Crohn's disease and ulcerative colitis, can cause chronic inflammation of the gastrointestinal tract, leading to symptoms similar to those of gastroenteritis. Managing these underlying conditions is crucial in preventing flare-ups and maintaining gastrointestinal health. Identifying the specific cause is crucial for effective treatment and management. Diagnostic tools such as stool tests and blood tests can help determine the underlying cause of gastroenteritis. Once the cause is identified, appropriate treatment can be administered, whether it be antibiotics for bacterial infections, antiparasitic medications for parasitic infections, or dietary changes for food intolerances. Consulting with a healthcare professional is essential in managing gastroenteritis and preventing complications. Gastroenteritis typically manifests with a combination of uncomfortable symptoms. Diarrhea, characterized by loose, watery stools, is one of the hallmarks of this condition. It often occurs alongside nausea and vomiting, which can lead to dehydration if not managed properly. Abdominal cramps and pain are also common complaints, ranging from mild discomfort to severe cramping. These sensations arise from inflammation in the stomach and intestines. Fever may accompany these symptoms, signaling the body's immune response to the infection. The severity and duration of symptoms can vary depending on the underlying cause and individual factors. While most cases resolve within a few days, some individuals may experience prolonged symptoms, especially if the cause is bacterial or parasitic. Gastroenteritis spreads easily through various routes, making hygiene practices crucial in preventing its transmission. This highly contagious condition can affect anyone, regardless of age or health status, and understanding its transmission is key to controlling outbreaks. The most common mode of transmission is the fecal-oral route, where contaminated feces come into contact with the mouth. This can happen when individuals do not wash their hands properly after using the restroom and then touch their mouths, or handle food that others consume. This can occur through direct contact with an infected person or contaminated surfaces. For instance, shaking hands with someone who has not washed their hands after using the bathroom can transfer the virus. Similarly, touching doorknobs, light switches, or other common surfaces that have been contaminated can also lead to infection. Food and water contaminated with the infectious agents are significant sources of outbreaks. Contaminated water can be a major issue in areas with poor sanitation, where sewage can seep into drinking water supplies. Similarly, food can become contaminated during preparation if proper hygiene practices are not followed. Improper food handling, inadequate cooking temperatures, and contaminated water sources can all contribute to the spread of gastroenteritis. For example, raw or undercooked poultry can harbor harmful bacteria, and if not cooked to the right temperature, these bacteria can cause illness. Additionally, food that is not stored at the correct temperature can become a breeding ground for pathogens. It's essential to practice safe food and water hygiene to minimize the risk of infection. This includes thoroughly washing fruits and vegetables, ensuring that meat is cooked to the appropriate temperature, and using clean water for drinking and cooking. In areas where water quality is questionable, using water filters or boiling water can help reduce the risk of contamination. Close contact in crowded settings, such as schools, daycare centers, and nursing homes, facilitates the rapid spread of the infection. In these environments, individuals are in close proximity to one another, making it easier for the virus to spread from person to person. Children, in particular, are more susceptible due to their developing immune systems and tendency to put their hands in their mouths. Good hygiene practices, including frequent hand washing and disinfecting surfaces, are paramount in these environments. Regularly cleaning and disinfecting high-touch surfaces, such as doorknobs, light switches, and toys, can help reduce the spread of the virus. Hand washing with soap and water for at least 20 seconds is one of the most effective ways to prevent infection. In situations where soap and water are not available, using an alcohol-based hand sanitizer can be a good alternative. If you or someone you know is experiencing symptoms of gastroenteritis, such as diarrhea, vomiting, and stomach cramps, it's important to seek medical advice. Early diagnosis and treatment can help manage symptoms and prevent the spread of the infection to others. Staying hydrated and following your healthcare provider's recommendations are crucial steps in recovery. Community education and awareness are also vital in preventing the spread of gastroenteritis. Public health campaigns that teach proper hand-washing techniques, safe food handling practices, and the importance of clean water can make a significant difference. Providing access to hygiene kits and clean water sources in underserved areas can help reduce the incidence of this illness. By practicing good hygiene and being mindful of how gastroenteritis spreads, we can protect ourselves and our communities from this common but preventable illness. Teaching children the importance of washing their hands and maintaining cleanliness can instill lifelong habits that contribute to better health for everyone.